Welcome to this mini lecture for the shoulders. The shoulders consist of the clavicle bone, or collarbone in slang terms, the scapula, which comes over the top as well, and then of course the humerus bone. All together they make up what we call the glenohumeral joint, which is a ball and socket joint which has 180 degrees circumduction, which has a wide range of motion laterally and medially, a wide range of motion posteriorly and anteriorly. Additionally, the idea of rotation. Combined together, it is one of the most moving joints in the human body, and if anyone's had a shoulder impingement or shoulder pain, you know how debilitating it is and how important it is to maintain the integrity of your glenohumeral joint for the rest of your body, because a lot of the muscles will connect up through into the head, and then additionally a lot of the muscles will come down and affect the muscles through the rib cage, the middle of the back, and even the lower end of the back, for example, our latissimus dorsi. The amount of ligaments and tendons that cross over this joint is enormous. We have many ligaments that will attach the clavicula to the shoulder blade itself, or scapula. We'll then have a number of tendons which will go from our deltoid muscle over the top and insert from the humerus into the scapula. We have the big neck muscles that come down and attach into the shoulder as well. The upper trapezius, the levator scapulae, additionally the rhomboids, which pull us back. And then we have the four all-important rotator cuff muscles: the supraspinatus, the subscapularis, the infraspinatus, and the teres minor. There are a number of others as well, so I encourage you to read further and deeper. So these rotator cuff muscles will all help lift the arm out and rotate, or lift the arm, rotate the arm down, or pull the arm in. So when we have poor function of our shoulder, certain ergonomics, so for example, our posture, how our shoulders will sit on our rib cage, and how that will affect our neck position. If we have forward-leaning shoulders, we will generally have a forward-leaning neck. If we are too stiff at the back and walk around a bit like a robot, then we lack rotation within the thoracic vertebrae section. You will also contract your muscles at the back of your neck, which could cause tension headaches. And I think the worst one of all is the frozen shoulder, where the fluid inside the joint will become inflamed, and therefore any type of movement within the ball and socket joint will irritate the synovial fluid, and then you'll have pain. Hence, you won't want to move it, and we call it a frozen shoulder. So there are many flow-on effects from poor shoulder position, poor shoulder function, and weakness. Make sure that you cover all the range of motions of protraction, retraction, elevation, depression, abduction, adduction, flexion, and extension. I hope this video has resolved a few of your questions and you understand the shoulder girdle a lot more. Thank you.